Good afternoon, everyone. Welcome to the 26th episode of the Marathon 2020 event. I'm Adrita P. Chaturvedi, the host for the session. The Marathon event is initiated by Nidan Inclusive School, Atman Counseling and Rehabilitation Center, and Satwa trainers, counselors, and consultants, and is powered by the Psych Athletes. Our honorable guest for the session is Dr. Preeti Mathur, Head of the Department, Counseling and Special Education, Delhi Public School, Bangalore, North Bangalore, Karnataka, India. She has also been the director of Counseling Division and School Clinic at Aadhar, the Center for Child Development and Psychological Counseling run by Aadhar Gyan Dhatri Samiti, Bhopal. Today we are going to talk about sexual and reproductive health and its impact on mental health with our honorable expert for the day, Dr. Preeti Mathur. Hello, ma'am. Thank you for joining us today. Ma'am, you have to unmute. Ma'am.
Sorry. Good afternoon, everyone. Thank you, Adrita, for wonderful introduction. First of all, I want to say thank you to Kala Mohan ma'am, Nivriti ma'am, and Sonam for giving me opportunity to talk about the issue which is not at all talked about actually. So thank you so much.
Yes, ma'am. So, as we know that sexual and reproductive health and well-being are essential.
Sexual health. Am I audible?
Yes, ma'am. Go ahead. Yes, ma'am, you're audible. Go ahead.
Okay. So a very different topic is given to me that is related to sexual health and sexual and reproductive health and its impact on mental health actually. When we talk about sexual and reproductive health, it is basically an integral part of overall health, well-being, and we can say quality of life. It is an integral part of that, and it is a state of complete physical, mental, social, emotional well-being. And when we talk about sexual and reproductive health, we are not going to talk about any type of disease or dysfunctions. We are going to talk about in general. But this is very this topic is very much close to my heart, but very least discussed in open forums. So I think this is a very good topic, and I'm sure we are going to have a very good discussion today.
Sure, ma'am. So, as we know that sexual and reproductive health and well-being are essential if people are to have responsible, safe, and satisfying sexual lives. Sexual health requires a positive approach to human sexuality and an understanding of the complex factors that shape human sexual behavior. These factors affect whether the expression of sexuality leads to sexual health and well-being or to sexual behaviors that put people at risk or make them vulnerable to sexual and reproductive ill health. Now, ma'am, I would like to ask a few questions from you related to sexual and reproductive health. Could you let us know how is sexual and reproductive health related to mental health?
Okay. So when we talk about mental health and sexual reproductive health, they are the integral part of overall health and well-being of an individual. If we give example of from different phases of life and changes in reproductive and sexual health behavior, we can understand the importance of the sexual and reproductive health in determining and shaping the mental health and the vice versa. So they are interrelated actually. So when we talk about SRH or sexual and reproductive health and mental health, they are interdependent and interconnected to each other. Okay. So I want to give some examples to you so that will be very easy for all to understand how mental health and sexual reproductive health are interrelated. When we talk about the puberty stage, most of the young people go through lots and lots of physical, emotional, mental, psychosocial changes and are susceptible to ranging from lower degree to higher degree of mental stress, actually. And these mental stress are even higher, especially when they question their sexuality or gender identity and all these things. So these physical changes, when accompanied with some cultural practices or tradition, they can create a very conducive environment for poor mental health actually. So, as for example, menstruation. Menstruation is still a topic of stigma and discrimination in most of the cultures. I'm not talking. At present, I am living in southern part of the India, but here menstruation is taken very, very positively. But in most of the part of India, it is still a thing which is very much tabooed, or discriminations are happening, and people are practicing untouchability in many cultures actually. Girls and women in some areas are sent to some distinct place or cow hut, or uh, usually in when I talk about Madhya Pradesh, there is a tradition called Chaupadi. Chaupadi is basically they are sent to, when they have their menstrual periods time, they usually are sent to some other place to live there, and social distancing is maintained, and they are kept there. So definitely, when while following Chaupadi, many women and young girls have been reported to be harassed, raped, killed by snake bites. Even other animal and natural disasters are also there. So overall, if we can talk about the mental health of those girls who are sent to that cow hut or for Chaupadi, isolation from a family, social exclusion, definitely lead to low self-esteem, and fear of sexual abuse and assault may lead to mental stress and results into trauma and depression, which definitely will lead to bigger mental health issue. So I think we have to talk about this at each and every age. Second point which I want to discuss, when we talk about the physiological changes happening in especially when we talk about females, uh, gynecological condition affects women's physical and mental health and well-being more actually. Young women are more vulnerable towards STI and RTI because of thinner vaginal wall than the elder women. And stress due to RTI, I can say. I'm not talking about STI right now, but definitely STI is one of the important reason which may create mental stress among the students or among the people. Stress due to white discharge, which is very much common among the teenage girls and women. Unattended pregnancies, unsafe abortion, they all can lead to onset or recurrence of severe mental health conditions, actually. Even if we talk about perinatal depression, it is most prevalent and severe complication of pregnancy and childhood. And studies say that miscarriages are strongly linked with depression. So we have to talk about mental health and sexual and reproductive health again and again with all the people. Another example I want to give, if a mother, expecting mother, or during pregnancy or post childbirth, uh, if the mental health is not conducive, then it not only hamper the mental, physical, and social well-being of mother, but also the child care practices and overall development of the child. So it is very much important to talk about sexual and reproductive health and mental health again and again with each and everyone. Similarly, I want to discuss about the subordination of women because of poverty or illiteracy, or substance abuse, or dependency on financial security over men. Sometimes it makes difficult for women to insist on safer sex practices also, and then women become more prone to STI, including HIV and other syphilis and other issues. And when we go through the various researches, they show that mental health problems such as anxiety disorder, insomnia, depression, acute psychotic disorders, or mental retardation, or dementia among people living with STIs due to mental stress caused by shame, guilt, depression, fear of discrimination, sense of isolation, and lack of support. So each and everything is interrelated, actually. So we cannot discriminate that this is something related to sexual health and this is related to mental health. Another very important point which I want to focus and about which I want to discuss is infertility. When we talk about sexual and reproductive health, actually it is very much related to our safer sexual practices and the reproduction only. So infertility is yet another reproductive issue incurring mental health issue actually. Issue of infertility are of immense shame among both males and females. They don't want to discuss about that. They don't accept that they are going to they have this issue of infertility and the guilt, fear of early sexual experiences, and use of contraceptive, substance abuse, misdeed of past life is prominent among both men and women. Uh, Although women and adolescents are more vulnerable to that, but definitely men's are not. We cannot left them. Men's are equally vulnerable to these things. And likewise, sometimes when we talk about women again, during when the onset of menstruation happen, definitely they go through lots and lots of mental trauma. Similarly, when there is menopause also, that post reproductive cycle started, and this menopause also lead to fluctuation of emotions and lead to mental tension and anxiety among women. So each and every stage of our life is actually related to mental health when we talk about sexual and reproductive health. So in men, we can see that addiction is there, substance use disorder is there, psychopathic personality disorder, and these are basically common among men. But but definitely it is somehow related to the depression, anxiety, or unidentified psychological distress, and very much common among men. These areas are. So I think we have to talk about these issues, although it is a taboo among most of people, and they don't want to discuss about that. But I am really very thankful to the team that they have given me opportunity to discuss about all these things. Thank you.
So, ma'am, on this note, I would like to know that, like, how does sexual and reproductive health would actually become a taboo for men too? I mean, we know that it's already a taboo for women, but how can we, make men more aware about it? That like it's all right to have infertility, or like how can they express their problems, towards the society?
Uh, the first thing is we have to give them an option that so that they can discuss these things. Actually, when we talk about sexual and reproductive health, uh,
Mm.
in our India, I have seen in many schools when the topic of sexual and reproduction, when we talk about that reproductive organs, nobody is ready to
Mm.
talk about that. I have seen in many schools that
Yes.
topic is left behind, and teachers are focusing more on other
Mm.
systems, but
Yes,
not
ma'am.
even the people who are very learned and who are working in the field. They don't want to talk about that. So and when the things are not discussed, actually they create more curiosity among people, and that curiosity may lead to activities, or may lead to things which are not very healthy or acceptable to the society. They try to explore things on the social media, or try to check with their friends who are also at the same platform, huh? And they don't have the complete information. They don't know how to
Mm.
interact and how to deal with the problem. So I think that make them more vulnerable, especially men and women. I think we as a woman are blessed that we can discuss these issues with our mother or aunties or
Yes, ma'am.
didis or many. But unfortunately, men's because they are grown like that, they hesitate to talk about those issues. So I think they are equally vulnerable. But the thing is, we have to start talking about these issues again and again.
Yes, ma'am. Absolutely. So moving on to the next question. Can you brief us about the factors that influence reproductive health?
Factors that influence reproductive health. Actually, first thing, I think we have to start from the very primary source. That if I am responsible for my sexual and reproductive health,
Mm.
when we talk about the primary fact, I think we have to follow certain rules. We have to take care of our hygiene point of view and keep ourselves safe. And whenever we are having any difficulty with related to urination or any boil or any discharge or anything like that, I think we have to go to the nearest place. First, we have to discuss in the family, especially a mother. You can talk to your mother and go to the nearest place where you can talk to the gynecologist or especially trained counselors on these issues. So that is very much important, and definitely to ensure that you cannot go into these issues or sexual and reproductive health difficulties. Actually, you have to eat good food, freshly cooked food, lots and lots of fiber, because fiber actually help us in um, proper functioning and all those things. Huh? And lots of locally available fruits and vegetables you have to eat, and proper sleep, plenty of water. I think when we talk about mental health, all physical and mental health issues are interrelated, interdependent. Huh? And the cleanliness of surrounding is equally important when we talk about sexual and reproductive health, because most of the infections we got through this cleanliness thing. So that cleanliness is very much important when we talk about. At secondary level, what we can do is in school level or in colleges level or when we are staying at home during this pandemic, I think we have to start talking about these issues. Okay, this is very normal thing. When we talk about our fever, headache, and aches, other aches, I think we have to talk about these mental health issues or sexual health issues also. Whenever the child is having, or a person is having, or a mother is having, or father is having any issue related to that, I think they have to go to doctor and consult them, and age appropriate, because at a different age a different type of issues usually come up.
Yes, ma'am.
So age appropriate comprehensive sex education is very much required. And if people are not finding it conducive to talk about that, I want to tell you that in each and every hospital, especially in government hospital, urge counselors are appointed. Urge counselors are basically adolescent reproductive and sexual health counselors. They are the trained persons, and they can talk about these issues very clearly with their expertise in that. So I think whenever we have issues like that, we have to go and contact them. And for girls, the gynecologists are the best person who can tell them how to save themselves and how to get out of the infections and all those things. So I think we have to consult these things. At a tertiary level, we can create awareness like this program, and we have to do more and more programs using such platforms to create awareness about these things. So various interventions are required to educate people about this sexual and reproductive health issues.
Exactly, ma'am. And now moving on to the next question is that what interventions could be made to improve reproductive health?
When we talk about intervention, I spoke about that. Na, ki when we have to talk about the intervention to improve sexual reproductive health, we have to talk a lot about that. We don't have to hide these things. Huh? Government has taken an initiative, lots and lots of, whenever we go to any movie halls, definitely before pandemic, we were used to go to malls and halls, and there information about how to save ourselves, where to contact, and all those things, all those informations were there. So the only thing is we have to create awareness, and we have to create an environment where we can talk about these issues very frequently, actually. So proper diet, proper safety, proper cleanliness, all these things, interventions are basically required. And intervention from government perspective, government is doing a lot, but most of the people are not aware about that. So I think we have to
Okay.
start exploring. Whenever we are having any issue, I think we
Mm.
have to, and this is a basic tendency of human being nowadays. Everything is available on social media, so we usually search on that and try to figure it out. But in this particular issue, I think we have to talk to the gynecologist or a
Mm.
person who will give us a complete and correct information, because each and every body is different, so the reactions
Mm.
and health related issues are totally different. But definitely, when these issues are not addressed properly, it will lead to mental health issues among people. So, the only and the
Mm.
important intervention is talk about that and go to the services which are provided nearby.
Absolutely, ma'am. I'll make sure that I make people aware about this. And so, since you mentioned about internet and Google, so I would like to know what is the impact of social media on the sexual behavior of adolescents?
Actually, internet and mobile technology have become integrated part of our life as a essential form of communication, actually. And now the entire generation, when we are talk about that, in last session, I heard about that addiction about
Yes,
internet
ma'am.
and all those things and the ways to. But the entire generation, whether we talk about the younger kids or middle-aged people or elderly people, each generation has grown up with the new channels of gathering information and sharing information, actually. So, when we talk about impact of social media on sexual behavior of people, I want to share
Mm.
one study conducted in uh, Ghana. Actually, they studied 400 adolescents between the age of 13 to 19, and the sample was studied about their social media presence and how they use that to get the information about sexual and reproductive health, actually. So the result revealed that the majority of respondents share their sexual and reproductive health information regarding personal experiences with their friends through social media only. So social media become a platform where they are
Mm.
discussing their issues or health issues with their friends. And WhatsApp was the medium mostly used for sharing sensitive sexual reproductive health information, followed by Facebook, actually. And researchers also found that adolescents share lots and lots of sexual reproductive health information on social media. This include condom use, sexual experiences,
Mm.
even abortion, changes during adolescent age, even depression. Now they are using social media like anything. So, and there is a significant difference among males and females adolescent on the kind of information they are sharing.
Mm.
In social media platform, it was observed that males are sharing more about sexual reproductive health
Mm.
than females. Few years back, I was working with an Urge helpline in Bhopal. There also, when telecounseling was provided to students and adolescent and to others also, and most of the callers who talk about sexual and reproductive health was male.
Mm.
Females are not coming up, still not coming up for these issues. But technology is here to stay. While it never replaces human interaction and intimacy, actually,
Mm.
digital world to reach large number of youth with accurate sexual health information cannot be underestimated. And that's why I think I want to tell you that UNFPA and Government of India has developed one app called Sathya app, Sathya Salah. If you want to search, you can search on Google Play. You will get that, and on
Mm.
that platform, on that with the use of that app, you will get the correct information about reproductive and sexual health. And definitely the number which is there is an old one. Now in Madhya Pradesh there is an Umang helpline. Uh, I think the number is 14445. You can contact them. They will give you the correct
Yeah.
information because they are trained with that. So we can use this social media platform to create awareness among people about this
Hmm.
SRH. And I think we have to encourage dialogue between experts,
Hmm.
educators, parents, and youth to increase the possibility of healthy sexual experiences. How to be safe. We have to teach each and everyone that how to be safe, whether they are going for some sexual experiences or going to get married or anything like that. So I think
Hmm.
now we have to train young brains to how to be safe actually, and how to be healthy, sexually and reproductively healthy. So
Ma'am, out of curiosity, I just had one question. Do you think that social media can also have a negative impact on the kind of information they're getting? Like, especially the teenagers.
yes,
I mean, they are.
definitely. Yeah, definitely. I spoke about the positive impact of social media,
Yes,
but
ma'am.
definitely it has a negative impact also, because all the information available on net is not correct. It
Hmm.
can lead you to the place where you can harm your physical, mental, and emotional,
Hmm.
psychosocial, every type of health will be happening.
Yes, ma'am.
So I think we don't have to deny that. That's why I'm again and again emphasizing that we have to create a platform for a dialogue
Hmm.
between a trained people, experts, educators, parents, and youth. We don't have. I think we are using this social media platform right now to create awareness. And
Yes, ma'am.
with a
Yes, ma'am.
trained person, if you are talking about these issues,
Hmm.
I think we are on the right direction. But when we go for the search of or about these areas, about the sexual and reproductive health, I think I don't know how much we have to trust on these uh, this social media platform. So I always emphasize that for reproductive and sexual health issues, I think we have to we have to somewhere rely on human interaction and intimacy
Yes,
about
ma'am.
that. But definitely, social media platform give you an opportunity to
Hmm.
discuss more and more about
Exactly.
that.
Yes, ma'am. So, ma'am, coming to the last question of the session, what are some practical challenges faced by disabled people to maintain their sexual and reproductive health?
Very good question, Adrita. At present, I am working with disabled children.
Hmm.
Not only I don't say disabled, but they are especially able children.
Hmm.
Although when I
Yes,
am
ma'am.
working in a school scenario, all are from the very good family,
Hmm.
and they are getting all care from the parents. And definitely, on regular basis, our life skill teachers are talking to them, and even we have a team of doctors who are giving them this type of education also. But I can say the maximum people are not blessed like those children with whom I am interacting right now. When I see the entire scenario related to children with disability or person with disability, uh, they are often denied of this sexual reproductive health information. The access to abortion services or various sexual and reproductive services, and they are likely to experience more physical, emotional, sexual abuse, even gender based violence, and they are more prone towards HIV and other STI because the information access is not with them. Nobody is them there to guide them. And various researchers show that the disabled people have poor mental health because the treatment they receive from the society.
Yes,
They
ma'am.
are excluded. They are excluded, and
Hmm.
because of this exclusion, sometimes nobody is there to talk to them about their sexual and reproductive health. Actually, and actually when we talk about disability, usually it comes with various type of mental disorders also. They likely to have schizophrenia or bipolar disorder. I'm not talking about the entire population, but they are more prone to that. Anxiety disorder or depression or obsession or dementia or behavioral issues. uh, Actually, the women, especially a person with disability, are more prominent. The violence is more prominent among them. uh,
Mhm.
long-lasting history. When we go through the data and all those things, there is a history of forced sterilization, hysterectomy,
Yes, ma'am.
abortion among women with psychosocial disability, actually. And at institutional measure is also not taken for the menstrual hygiene and to avoid pregnancy and unwanted pregnancies and all those things. So I think we have to talk a lot about a person with disability when we talk about SRH. And most of the people with disability, when they have issue like that, they are not directed towards the gynecologist or trained counselors for the health. So their situation is not good. I think we have to start working for them to create
Yes.
information about they not only for sexual and reproductive health. I think for overall thing. Some are blessed, but most of them need support from the young youth like you.
Ma'am, sorry to interfere, but there is an important question from the comment section. That is it true that the child who do not get freedom and who go through too much of suppression from parents are more attracted to sexual needs early in life?
Yeah, definitely. If the child is not getting any, definitely, if I say na, कि mental health and sexual health, they are interrelated and interdependent. Na? So, if the child is not getting attention from family members or friends, and
Mhm.
so definitely to get attention or to fulfill their needs and queries and all those things, they usually go to social media and on social media, as we discussed earlier also, everything which is there is not appropriate actually. So they are more susceptible towards this inclination towards sexual practices, and more they are involved in that, the hazard for well-being and things are there. So I can say that they are interrelated, and this internet exposure has created uh, positive things also and the negative thing also. So,
Thank you, Miss Ma'am. Thank you so much for joining us
so I
today, ma'am. It
think
was a
we
pleasure
have
to
to
have
give
you
freedom
today with us.
as a parent or as a hello,
Hello, yes, ma'am. Can you hear me?
hello,
Ma'am, actually, we
am
are
I
short
audible?
on time.
Huh.
Yes,
Yeah.
ma'am. Yes, ma'am. Ma'am, we are short on time. We
Okay. Okay.
our session is about to finish. Yes, ma'am. So thank you so much for joining us
Okay.
today.
No
It was a
issue.
pleasure to have you with us. And I hope the viewers have also enjoyed the session and they have gained some knowledge through this. And thank you so much, everyone. I hope you please comment on the comment section and like the video and share it as much as possible. Thank you so much. And we welcome the next speaker of the 27th session. Thank you so much.